What is an automated external defibrillator?
It helps an individual who has had a cardiac event, who has collapsed, that may be in a cardiac arrest, and they're in an irregular heart rhythm. And the AED will go ahead and deliver a shock, which will take them out of that irregular heart rhythm and put them back in a regular heart rhythm to hopefully take them out of cardiac arrest.
If you believe someone is having a cardiac event, the first step is to call 911 and make sure medical personnel are on their way before using an AED.
I think the biggest thing is identifying that individual, getting the help to you, and then identifying, are they in a cardiac event? And if they are, just get that AED on. It's going to save lives.
Once that's done, using the AED is fairly simple.
What we would do is we would find that individual, we would find that patient, we would check to see if they were okay. If we were checking their pulse, what would happen is we would find no pulse. We would have activated 911 already, and at that point I would say, this young lady in the brown jacket, could you please get me the AED and bring it to me? Once that AED came, I would open it up. If there were pads in there, I would place those pads on the chest, and they would go anterior and what we say is lateral, so on the top and on the side. And we try to go to the upper shoulder because we're going to be doing CPR in the middle of the chest. So while that person is doing CPR, I'm putting those pads on. Once those pads are on, I'm going to plug in the adapter to the machine. Once that's done, I'm going to press analyze. When I press analyze, everybody has to stay clear of that patient. Nobody can be doing CPR or touching the patient. Once it analyzes the rhythm, then it's either going to say shock advised or shock not advised. If the shock is advised, we would still stand clear. We would wait for the machine to charge up the energy level. It would then say shock, made this really obnoxious noise, and we would hit the shock button. That shock would be delivered, and then we would go right back into compressions. And then that clock would start, and we would reevaluate in 2 minutes.
AED classes are held at MVHS for around $50. There's no set minimum age, but professionals advise that those old enough to babysit should know how to use an AED. The certification for those classes lasts 2 years. Reporting, Parker Tully, Eyewitness News.